So it is a great privilege, really, for all of us here to join in welcoming Rosalynn Carter. Mrs. Carter.
And thank you for having me here. I'm really excited, and I got to tour the portrait museum, which I hadn't seen, and see Jimmy's picture for the first time, that portrait in there for the first time. And so I've had a very nice visit. And I've been on book tour for a week now, and I think I practically know my remarks by heart. So I didn't bring them with me this morning. But I get two questions everywhere I go. One is, how did you get involved in mental health? And the other is, why did you write this book? Well, I began campaigning for Jimmy for governor a very long time ago. The Community Mental Health Centers Act had been passed, and people were being moved out of the institutions into the communities with no services. And I had, every day, somebody asked me, what will your husband do if he's elected governor for people with mental illnesses? And I got more and more concerned about it. And one day I was standing at a cotton mill in Atlanta, shaking hands at a shift change, because that's really good. You get to see all that are coming in to go to work and all that are going out off work for the night. It was 4:30 in the morning. I'm kind of crowded up here. Knock it off. And nobody had come yet. And suddenly this woman, she was little. She had lint all over. She looked so weary from working all night long. And I asked her, I said, I hope you're going home and be able to get some sleep. And she said, well, I'm going home and I hope I get some sleep, but we have a mentally ill daughter at home, and we have a hard time making ends meet and caring for her. So my husband stays with her at night while I work, and I stay with her in the daytime while he works. And it haunted me all day. What was she going to find when she got home? Was the child going to be awake already? And I worried about it all day. And that night I was in a town. This was a very disorganized campaign. It was the first time Jimmy ran. We lost, but our leading candidate had dropped out, and Lester Maddox was the candidate left as a Democrat, and we couldn't let him have it. He was pretty much a segregationist. And so we got in at the last minute. And so I would just get in the car and drive to a town, pass out brochures, and drive to another one. Had one of my sons with me. And so that night I was in a small Georgia town, found out Jimmy was going to be there that night for a rally. And so I stayed, got in the back of the room. He didn't know I was there. And I heard him speak, and then when everybody got in line, I got in line at the back of the room. And when he got to me, I don't know how many receiving lines you stand in, but it's part of my life. And you'll put out your hand for the next person while you're still talking to this one. And that's what Jimmy did, and he reached like this. And when I got in front of him, he said, what are you doing here? I said, I came to see what you're going to do for people with mental illness when you're governor of Georgia. And he said, we're going to have the best program in the country, and I'm going to put you in charge of it. Well, of course he didn't put me in charge of it. But 4 years later, when he was elected governor, he established the Governor's Commission to improve services to the mentally and emotionally handicapped. And that was the beginning of my education about mental illnesses. And the more I learned about it, the more I saw how much people needed help. Because people back then wouldn't talk about mental illness. Nobody wanted to be associated with it. Nobody wanted to work with me on the issue. Somebody had seen actually somebody heard me when Jimmy said that to me, and there was an article in the paper that I might work with mental health issues, and all of the advocates in Atlanta descended on me, all 5 of them, and that was it, 5 people. And even after he got to be governor, and I tried to get people to come to meetings, my 5 advocates were there, and maybe a few from the government because Jimmy was governor. And it was really difficult. But I stuck with it, and then when I campaigned for him for president, my bio had a little blurb in it that said I was working on mental health issues. So every time I got off the airplane, people wanted to take me to see their mental health programs. And if they were good, and there were few, but very few, and if they were bad, they wanted to show those off if they were good, but if they were bad, they wanted me to get help for them when Jimmy was president. And so less than a month after he was inaugurated, he established the President's Commission on Mental Health. We worked really hard. And in October of 1980, we got the Mental Health Systems Act of 1980 passed. In November of 1980, a new president was elected. As Jimmy said, he was involuntarily retired from the presidency. And the next president abandoned my legislation. None of it ever took shape. And it was one of the biggest disappointments of my life. But now I have a really good mental health program at the Carter Center. I've worked on it ever since we left the White House. And the reason I wrote the book is because in 2002, another President's Commission, President Bush had a commission. And they reported that the report of the whole study was that the mental health system in the United States is in shambles. There's no way to fix it. We're going to have to start over. Well, having worked 39 years, well, not quite then by 2002, to know that when I started it, there was nothing there, and in 2002, the system is in shambles. And the sad part is that we know what to do. We know what to do, we don't do it, and millions of people are suffering. And it just hurts me so bad. And so I decided to write this book because I want people to know what I know, that today mental illnesses can be diagnosed, they can be treated, and the overwhelming majority of people can lead normal lives. Living at home, working, raising their families, people don't know this. And today, people can recover from mental illnesses. And the whole mental health system is beginning to change. Instead of people going in and like I had one young man in Atlanta tell me that he's recovered. He's an artist. He's making his living, having a little bit of a hard time as an artist, but he's making his living. Habitat for Humanity built the first house for mentally ill people in Atlanta. I laid the cornerstone for his house. He's married and just doing great. And he told me the first time he went to the doctor, he was young, he was in college, he was planning to be a great artist, and he is a great artist. And the doctor said, diagnosed him with bipolar and said, "You'll never be a great artist." And that's the way people have been treated in the past. This is good, you have a mental illness, you won't be able to do a lot of things you want to do with your life. That's the wrong way to approach people with mental illness. Now, the consumers themselves, people living with mental illnesses, have begun working together. And I'm trying to time myself because I can talk a long time about this. But the consumers got together and decided that these were ones that had had bad experiences with the mental health system. They decided they needed to be involved in their care and what kind of medications they took. And they started helping each other. And then this young man that I've worked with forever in Georgia established the first consumer network program in state government and actually has been able to get Medicaid to pay the consumers for helping others. And he said it makes a total difference in their lives because Medicaid doesn't pay for work that somebody does, work when somebody is incapable. So it gives them respect, and they're recovering. And we found out even from serious mental illnesses, people can recover. So I wrote this book because I want people to know that. And we have to have the political will to do something about it. And I think now mental health has gone up and down. The president will be favorable to the issue, and there will be, well, Jim has started great research funding, with great research funding. It trickled along, and then when President Bush came in office, it was the decade of the brain, and he added large sums of money to research. And now today, as I said, we can help people and help them get over their mental illness and recover. And I just got back from yesterday from talking to Secretary Sebelius, Secretary Solis. Sebelius' father was governor when Jimmy was governor. Solis interned in Jimmy's office. Both of their assistants have been coming to my mental health program at the Carter Center. Feel just like I do. I've got some hope. So it's a good time for me. And now I'm supposed to read you something, so I'm trying to rush. One of the other good things that's happening is that law enforcement officials are doing great things, which is kind of unusual, but really good things, some really good things that are happening. A lot of it is from law enforcement. And there was a bad incident in Memphis, Tennessee, and the city, mentally ill person was shot 6 or 7 times, and the city just became really upset about it. The people in the city. And so the chief of police realized he had to do something about it. So that's where I'm going to start. A partnership was formed among the Memphis Police Department, National Alliance for Mentally Ill, mental health providers, the University of Memphis, and the University of Tennessee, and the CIT program was developed, Crisis Intervention Training. In a 40-hour training program, special squads of patrol officers are taught how to identify someone who is in crisis, how to de-escalate the situation, and where to divert the individuals instead of arresting them. Today, Sam and Randy, the two who started, Sam was the chief of police, and Randy was a doctor who knew how to train people to act in crises. They're now leading a national effort. In fact, they're coming down to Americus, Georgia, our county seat, in a few weeks to start a program in my area. The costs are minimal because training is provided free by mental health professionals, advocates, most members of NAMI, and the police also participate on a voluntary basis. Recently, I had the chance to talk with a young man who has been helped by this program. His story is both frightening and full of hope. Tyler Lee Barnett grew up an only child in northern Georgia. His father died before he was born, and since his mother had to go to work, he was raised mostly by his grandparents. Tyler is now in his 20s and has bipolar disorder. He told me that for years he hung out with the wrong group, drinking, smoking marijuana, getting into trouble, and giving his family a hard time. One day, shortly after his girlfriend left him, taking with her their baby girl, Tyler learned that one of his best friends had been killed. He got drunk and stayed drunk. I couldn't stand reality, he said. It hurt. I drew inward. I was mad all the time and frustrated because I had no idea what to do. I got into fights with my best friends and yelled at my mama and my grandparents. I let down everyone I loved. And all this time, I was trying not to let anyone see how much I was hurting. Reality was too much to deal with. I was going downhill fast. Then at home, one day, he said he went wild, raging through the house. Alarmed and frightened, his grandmother called 911. Tyler told her to tell the operator that he'd kill any cop who came to take him away. Then he got his grandfather's machete and waited in the bathroom for the police to arrive. Soon, with the sirens screaming, they did. Now alone in the house, Tyler described he looked out a window, saw a cop behind a bush with his gun drawn, and knew whatever happened next was not going to be good. The phone started ringing, and it kept ringing and ringing. Eventually, Tyler picked it up. Much to his surprise, a man introduced himself as Captain James Scott and asked what he could do to help. I didn't want to help myself, but this man was actually willing to help me, and he was unarmed, Tyler said. I put the machete down, and I told him to tell the officers to lower their weapons, and I would come outside. Much to my surprise, they did. I was still on edge, but finally went to the screen door. Captain Scott was there, and I asked, "Haven't you ever had a bad day?" And Captain Scott said yes, and he replied, "And you're going to be all right. Come with me and we'll talk. Just me and you. Nobody's going to hurt you." So we sat down on the tailgate of my papa's truck, and I began to explain to the captain as best I could what was going on. Scott, a CIT-trained police officer, was able to peacefully resolve a potentially deadly situation and get Tyler to treatment. He got into treatment. He's doing great now. Even today, Scott regularly checks on him and helps when his grandparents call occasionally because he's not taking his medication. The words of his grandmother moved me deeply. We respect and are truly thankful for Captain Scott, CIT, and Judge Brown, Tyler's probation judge, all of whom understand how vulnerable and fragile a person with mental illness can be at times. It is my hope that through this program, CIT, many will come to a better understanding of the complexity of this illness. It is treatable. These ill people are deserving of our respect and understanding. We are extremely thankful that Tyler is part of our family. We love him, always will, always have. Thank you. Thank you.
Thank you so much, Mrs. Carter. We have received from a number of you some excellent questions and observations, and I suspect there may not be time to address all of them, but I will pose some at least and hope that we'll have the opportunity to hear Mrs. Carter's perspective. Some are very specific, and I thought perhaps we might start with those. The first one, with campus violence incidents making almost regular news, many with suspected cases of undiagnosed or unaddressed mental illness, what do colleges need to do differently, especially given that much mental illness surfaces during adolescence?
Mental illness is diagnosed in children, 50% of it by age 14. By age 24, 75% of mental illnesses are diagnosed. College campuses, today, Emory, I have helped, and Tom Bonerman, runs the mental health program at the Carter Center, is here. He's on the committee, and they have a program at Emory to help people with mental illness. It's happening all across the country because so many people, well, too many people are committing suicide. Did you know that 100 people commit suicide in our country every day? 10 children, including adolescents. And without exception almost, it goes back to depression. And they can be helped. And so college campuses are going to have to, and most of them are doing that now. And particularly since the university just recently that had so many deaths, so many suicides. Anyway, it has come to the attention, I can tell you from talking with the president of Emory, because we meet with him every other month. Emory is associated, we have a partnership with Emory University. So they're thinking about it very seriously now, and I'm really pleased to see that happening.
Thank you. This will be a brief question, but it's an important and growing one, and that is specific issues affecting the Hispanic community, particularly immigrants, and their access to mental health services.
We have a great need for cultural mental health professionals. It makes so much difference with somebody who has a mental illness if who they're talking to understands them. For instance, I had a big meeting for general public to come in to talk about mental illnesses. This woman came in. Her ex-husband's wife had put a hex on her, and she was just almost suicidal. and given medication, diagnosis paranoid, given medication, sent her home. Later it was found out that that is natural and normal in that culture, and it would make a total difference in how she was treated. And I had one doctor that told me that he went to Cambodia for about a month and to help train them on how to work with mentally ill people. So he said he started seeing patients, and the first patients he saw, he said, I asked the question we ask at home in the United States, do you hear voices when you're in a room by yourself? And the patient said yes. And every patient that came in said yes. And then he asked the staff, and they all said they heard voices. He asked the man who ran the program, and he heard voices. Excuse me. He thought this might be a really good place to practice. And then when he was getting ready to leave, we're telling him goodbye, the man in charge of the program said, and for the last minute we're going to be helping Dr. So-and-so. He said he's the only one among us who is not in touch with his ancestors.
The next question is one that's very familiar to you, Mrs. Carter, as a resident of Plains, Georgia, which is a small community. And it comes from one of our neighbors on the Eastern Shore, where their regional mental health clinic has been closed because of a state budget crisis. And so the question is, what can people in the less populated areas do to effectively advocate for and sustain these services?
It's very difficult, and I know because in Plains, Georgia, we just for the first time we have a new mental health, new person to head our mental health program in our area, and for the first time we have 6 beds. In the past we've had to go 60-something miles when anything happened. Or either what has happened is they're put in jail. The jails and prisons are the largest mental institutions in the country. Somebody said to me, we haven't de-institutionalized, we have re-institutionalized. And it's true. Major mental health. Los Angeles County Jail is the largest mental institution in the country. And it is a tragedy. And we know what to do. That's what's hurt so much. But I think the best thing people can do in a situation like ours is get advocates together and just talk to the local officials. It's what happened in Americas. We got very concerned, and they opened 6 beds, which is not enough, but it's better than nothing, which we had in the past. But get together and let the public officials know how bad we need services. And mental health has always been the first to go, first cut when you have to make budget. But I think now, as I started to say a while ago, it's been cyclical. I think the movement is too strong now to be stopped. And I think people are going to be paying more and more attention to it because of research and what we found, and because consumers are helping and people can recover now, but mainly because of the Vietnam veterans coming home. And I think that if people in the community have a veteran who's coming home, and like we have one at home, if they get together and demand some services for them, I think I think PTSD and traumatic brain injuries are going to help the mental health system almost as much as anything, because people in our country are concerned about it. And people don't listen much to mental health problems, but when they become concerned about our soldiers coming home, our servicemen coming home, to me, it's a moral issue, not only about servicemen, but about the way we treat people with mental health issues.
I'm going to paraphrase a little on the following question, but it really builds both on your last statement, Mrs. Carter, and also what you said earlier about the reality that in our time, it's very clear that people who have struggled with mental illness can and do go on to lead fulfilling lives. With that known, and much more widely known than in the past, why is there still a stigma about mental illness? And What in the world can we do to eradicate that stigma?
What I hope will happen, and have a little bit of hope because of PTSD, is that people just become so concerned that they demand of their officials. Everything starts at the local level. And if people just demand that we take care of our service people, that helps mental health. That helps them see what can happen, and they can get, if they can leave normal, well, somebody cautioned me about normal, but full, meaningful lives in the community. And it actually, like diabetes, you take your medicine and you live with it. Like heart disease, you take your medicine and you live with it. And that can happen today. And so I think if we could start a groundswell, and it might even begin with servicemen. We have one at home who is in the National Guard, and he came home, and they don't even have what regular military have, which is not enough. They're doing better than in the past, and I think really beginning to work at it. But he was in treatment for about, he's on drugs, and he was in treatment for about 3 weeks, came home. Nobody paid any attention to him. Nobody tried to get him back. There's no support for him, no follow-up. And he's now going into people's houses at night, knocking on the door, asking them for money, telling them his mother's sick or something. And it's so sad to see him because he needs help. And there's no help. And we are now beginning to work with him. But if we can have to have a groundswell, it has to come from the people. And that's another reason I think, though, that something might happen. And I do think that we can, what's the name of my book? Within Our Reach. Jim was teaching Sunday school last Sunday, and he was telling people about my book. I wasn't there because I had come here. And he said he couldn't remember the name of it. But I do think that if we take advantage of, we've got parity, we've got a new national health care bill, which includes mental health and substance use disorders in the basic health package. No pre-existing conditions, which so many barriers have been lifted, and so many concerned about PTSD. And I think there's more interest now in mental health than there has been in any time that I've seen. I've had more response to my book than I ever dreamed. And I've been with really, really enthusiastic crowds everywhere I've been. So you can see I'm a little bit excited, but I have this hesitancy because if we don't do it now, it's not going to be done for so long. So I'm just very hopeful. Thank you.
Thank you, Mrs. Carter, for an eloquent and deeply caring advocacy that, in fact, ending the mental health crisis is within our reach. I have one more question. You've got some real fans here. Mrs. Carter, as you may know, is the author of 5 books. And George from St. Mary's, Pennsylvania said, Mrs. Carter, I'm a fan of all, underlined, all your books. Do you have any plans for any others, and what will they be about? So we'll do that as the last question, and then we'll arrange for the book signing.
I'm so thankful to be through with this one. I worked on it for 3 years, and it started out to be a big book about my experiences. But over the points I wanted to make, you can read through it and you can see things, but the points I wanted to make needed to be specific and close together. So 160 pages, easy to read, a chapter on children. And let me say this about children's mental health, because today we have learned that mental illnesses are developmental diseases. Parents should watch their babies from the time they are born, how they bond with their parents, how they meet the age-appropriate milestones, how to crawl, when to walk, talk, and so forth. And as soon as they start around other children, how they react with playmates, with their peers in nursery school, watch them. Because today, if we can, the earlier we can detect mental illnesses, the better we can keep them from being really bad. We think that we can keep them so many times from developing into major mental illnesses and sometimes cure them in the beginning. And so I want anybody who knows people with babies, if they have see any deviation, take them to a mental health professional. And this is not, people won't go to mental health professionals because it labels them. They don't want to be labeled mentally ill. And I had a father tell me that he put off treatment for his son for a long time because he did not want to be the parent of a mentally ill child. And this is not because of the stigma, but this is not going to a mental health professional because the child might be mentally ill. It's going for a checkup, just like you go to get a physical checkup for a child. So I would hope that could become normal in people's lives, to be sure to check them physical, but if they see any deviation in this child is baby and growing, take them for help. Thank you.
Thanks to everyone for sharing this inspirational time. Mrs. Carter will be signing books, and I want to thank again on behalf of the Smithsonian Institution all of you for coming and learning more about what is, in fact, within our reach. Thank you.